Staging plays a critical role in determining the treatment approach for lung cancer, as it is a key prognostic factor.
So staging is the most important thing to have in any treatment of any cancer. I mean, and it affects treatment very much because it is one of the most important prognostic risk factor also. Say stage one lung cancer is there. The treatment of choice is most of the time surgery, or in some cases even localized radiation can cure the lung cancer. In stage two also, upfront surgery is an option, followed by chemotherapy. But when it comes to stage three, most of the patients they either go for chemoradiation or only systemic treatment like chemotherapy, and apart from that, either targeted or immunotherapy. And same for stage four, which is metastatic lung cancer. The treatment options remain only systemic treatment like chemo, target, and immunotherapy. So, practically speaking, stage one and two have good curative potential. Stage three is little bit curative, and stage four is obviously not curative option.
When it comes to staging lung cancer, accurate assessments are crucial for determining the right treatment approach.
So, for all the lung cancer patients, when they are diagnosed with biopsy, we get a whole body PET-CT scan. This is the foremost requirement in all stages of lung cancer, all patients of lung cancer. And when it is clear cut that it is metastatic on PET-CT scan, then there is most of the time no further investigation are needed, at least for staging. But further staging is required in many cases, specifically in stage two and stage three, and sometimes stage one. So those other modality of stagings are mediastinoscopy, okay, and other thing is EBUS guided biopsy, that is endobronchial ultrasound, and it guided the biopsy to evaluate the mediastinal lymphadenopathy and whether those nodes which are seen on PET-CT scan, they are pathological or not. So that is the role of mediastinal staging, most important in stage 2 and stage 3.
Early detection of lung cancer can significantly improve outcomes, especially in high risk individuals.
So in India, as such, the burden of COPD and tuberculosis is so much. Most of the lung cancer patients are initially diagnosed as either tuberculosis or just simple COPD whenever they have some respiratory symptoms like cough, breathlessness. But ultimately, they turn out to be a lung cancer. So, whenever this kind of new onset symptoms are there, a person should be aware that he or she needs to consider meeting a family care physician. And if there's some specific symptoms like blood in sputum, rapid weight loss, like 5 to 10% of weight loss in 6 months, which is not explained without otherwise. So this kind of symptoms point towards malignant etiology like lung cancer. And we can improve the early diagnosis by using a screening tool that is for high risk individual who are at risk for developing lung cancer, who have a significant smoking history of more than 20 pack years, or history of familial lung cancer, or other occupational exposure to carcinogens. They should be screened once in a year with a low dose CT scan. So in that way, we can pick up more lung cancer when they are even not symptomatic.